so for me it's an honor to present him. And well, just enjoy this lecture because he has a lot of experience. The lecture is not the ones announced, he's going to talk about high FiO2 during the perioperative period. Oh, Javier?
Thank you very much for the presentation, for the invitation, and thank you very much for the audience staying still here, you know, after a long period of talks during the day. Okay, I'm not on the wave, the new wave on the oxygen, because I'm going to defend oxygen, which is against we can't hear about everywhere, you know. But okay, let's just see that I have conflict of interest. I have conflict of interest because I'm defending I published, you know, pro use of high oxygen concentration. So this is my conflict of interest. That is not only a single paper, but many others, perioperative hyperoxia, benefits and risk, protection strategies using oxygen during cardiopulmonary bypass. So I have the conflict of, I am quite biased to use of high oxygen concentration, and I'm going to defend it. In any case, you can found today this new paper, Who Needs High FiO2, who is telling that World Health Organization, but also who of us. But in any case, there are a lot of opinions there based in several reasons, and we have our own opinion, recent opinion in this paper from the Turkish Journal of Anesthesiology. Oh, so but oxygen is really bad. If you go to the papers and you read the papers, you can see that oxygen impairs the innate immune response, and also impaired bacterial killing and producing edema, proliferation of type 2 and destruction of type 1 alveolar epithelial cells. Very bad, so now move away from oxygen. But if you look more, you know, precisely, you look at, they are all experiments in rats and rabbits, no humans. Second, spontaneous breathing or injurious ventilation. No experiment on normal ventilation. Third, a lethal experience. Lethal experience. If you give oxygen up to the rat dies, I mean, this is really bad, you know. You can find everything if in lethal experience or sublethal experience, yes, ventilating 100% oxygen for several days. Looking at the human experience with oxygen, you look at the oxygen, 80%, more than 24 hours, start to give some symptoms. No more than that. So you can breathe oxygen 80% for almost 1 day without any problem. And this is demonstrated because, look at this, it's a very nice paper on hypoxia, hypercardia and atmospheric control, looking at what is happening to our astronauts in the International Space area that we have in the atmosphere. Look at this. The patients not, but the astronauts, they are breathing at low atmospheric pressure, just 20% of the atmospheric pressure. So they need to breathe 100% oxygen for hours. Not 2 hours or 3, but more than 15 hours. And they have been breathing oxygen 100% in the spatial area for years, you know. And in this paper they said that the pure oxygen atmosphere planned for use spacecraft through the Apollo would not be harmful to the crew. Pure oxygen, not harmful to the crew. Longer periods. So oxygen definitely do not kill nobody. Okay. Okay, but in anesthesia, oxygen produces atelectasis because of gas resorption. Okay, that's in theory. I understand and I agree. But if you look to the clinical practice, you will see that if you apply 80% oxygen during induction of anesthesia, the amount of atelectasis is not different that they use only 60%. The amount of atelectasis with 80% is negligible. But again, if you go to the post-operative period, to the people, if you have given a high oxygen concentration during anesthesia for 2 hours, 3 hours, and you go to the post-operative period to see the atelectasis related to the high inspired oxygen concentration during anesthesia, you will realize that there is no difference in the amount of atelectasis in normal or high oxygen concentration in the post-operative period. Okay, this is the image, but I have the experience. My experience is that the patients with high oxygen concentration, the atelectasis are higher and they need more oxygen in the post-operative period. But this is not true. So this is a paper comparing 4 groups of patients with PEEP, without PEEP, high oxygen concentration, low oxygen concentration, combination of these 4 things. And they were looking at the need of oxygen in the post-operative period. And only those patients with no PEEP needed high oxygen concentration in the post-operative period. So the need of oxygen was not related to the oxygen during anesthesia, but related to the PEEP during anesthesia. They said that the results suggest that this is reasonable to use high inspired concentration in surgical patients. And they are totally right, because if you remember this graph of the time taken to the saturation when you use 100%, 80% or 60% of oxygen, you will realize that increasing the oxygen concentration, you have more time for a safer intubation. So I still recommend, like in obese patients, to use high oxygen concentration to a safer intubation. Okay, but let's change the topic, because I would like to stress that the oxygen is part of the ability of the phagocytes for killing the microbiome. So look at this oxygen in this chain of killing, telling that the oxidative killing is a function of tissue oxygen partial pressure. The higher oxygen partial pressure, the higher ability for killing bacteria from the leukocytes. So that's the physiology. But if you look to the clinic, you can see that when you apply a higher oxygen concentration during anesthesia, what you have is a higher tissue oxygen partial pressure in that patient. So if you increase the oxygen partial pressure in the tissue, you increase the ability for killing bacteria in the patients that you use high oxygen concentration. So in this, not only in the intraoperative period, but also in the postoperative period. So the hypothesis was that how the patients can improve the surgical site infection, reduce the rate of surgical site infection when you use a high oxygen concentration during anesthesia. And we did this study with 300 patients in colorectal surgery, and we we observed that when you use high oxygen concentration, the surgical site infection was reduced in about 50% of the patients. Okay, don't worry, years after, they published another publication in which you can see that the surgical site infection was not decreased because of the high concentration of oxygen. Different population, general surgery, abdominal surgery, emergency surgery, many types of surgeries. We were just doing the study on colorectal surgery. In any case, what I would like to stress is that no adverse effects were related to the high oxygen concentration. No adverse effects, no more atelectasis, no other problems related to the high oxygen concentration. After that, up to 2012, 7 meta-analyses telling that the oxygen is good, telling that the oxygen have no effect, never telling that the oxygen damage the patients or kill the patients. They were telling that the oxygen maybe have no beneficial effects, but never a damaging effect. And even in anesthesiology in 2013, with an editorial from our group, they were showing that, the meta-analysis showing the effect, the beneficial effect in all surgeries, even in all surgeries, colorectal, appendectomy, any surgery, the beneficial effect when you use high oxygen concentration. But if you look at only colorectal surgery, in colorectal surgery, the evidence was also good, telling that maybe oxygen at 80% decreased the risk of surgical site infection, and which is more important, do not increase the risk of postoperative atelectasis. So it's safe, okay? So, but anyway, the problem of the oxygen is not the infection, it's the damage to the organs because the free oxygen radicals that are produced when you use high oxygen concentration damage not only the lungs but also the liver and the kidney and many organs. So because oxygen kills the patient. But the point is that very recently have been published in 300 patients in cardiac surgery the use or high or low oxygen fraction, and they showed that there was no difference and there was no organ damage telling that development of acute kidney injury was not related to the oxygen. So today we can tell that all oxygen do not harm distant organs if you use it during anesthesia. So anyway, don't worry. So there is always a problem with the oxygen, and this problem of this paper was the oxygen. When you use oxygen 80%, the mortality of the patients after 2 years is higher when you compare a group of patients with low perioperative oxygen. So look at this follow-up study telling that deaths over the period were higher 23% when you use oxygen 80% compared to 18% of deaths when you use oxygen 30%. However, 1 year later, in 2016, we reviewed the data of other studies and we can assure that 80% versus 30% oxygen do not influence the outcome 1 or 2 years later. So don't worry, you are not going to kill the patient, not during anesthesia and not 2 years later. The patients have, these patients treated with high oxygen concentration, relation with the delayed death is not related to the oxygen concentration. Okay, just to show you that in the very recent meta-analysis, and a lot of papers already, a lot of papers up to the 2015 one. Now look at, again, is telling that oxygen reduced the incidence of infections. Here, look, the effect is not very big, but the point is that there is an effect, and also if you look mainly to the abdominal surgery, I mean moderate evidence for reducing the risk of surgical site infection in colorectal surgery, but which is very important is that maybe it's not, we are not sure, but we are sure that there is no any adverse effect. That there may be some effect, beneficial effect, and maybe we need more studies. In any case, it's not, you know, in facing all this evidence, it's not strange that the World Health Organization recommended FiO2 of 80% for all patients undergoing general anesthesia with endotracheal intubation for surgical procedures. So the World Health Organization have recommended already for all patients, and what I have to say is that I cannot imagine the World Health Organization recommending harmful things. I think that the World Health Organization at least is assured that there is no adverse effect. Maybe the beneficial effect is only for some patients, but there is no adverse effect if you use high FiO2. You're not going to kill nobody. So the Centers for Diseases Control were less stronger, and they tell maybe we cannot give any you know, very well supported recommendation because we don't know exactly if there is any effect or not. So we need new studies, and we agree. And we agree with that, and we are doing today a study. We started 2 months ago. We have recruited 200 patients comparing, you know, high FiO2 with low FiO2 during a protected strategy ventilation in patients for major abdominal surgery to see if there is any beneficial effect or not, because we know that there is no adverse effect. If there is any beneficial effect on surgical site infection when you use high versus low FiO2. So my conclusion is that if you use perioperative hyperoxia, what you have a clear benefit in the induction period, no doubt. Use high oxygen concentration for induce the patient. Second, do not increase the risk of postoperative atelectasis. Don't worry about that. No problem. Okay. Third, does not induce postoperative hypoxemia or damage to the organs. And third, you may reduce the risk of surgical site infection and maybe in general the infections, but mainly, as we have demonstrated, in colorectal surgery. So, and there is obviously no demonstrated long-term mortality. Deny the people telling that there is a, you know, delayed mortality, because it's not true. That's it. Thank you very much for your attention.
Thank you very much.